Is it worth taking prednisone? A YouTube commenter recently said this: my adenoids are inflamed, so my doctor prescribed prednisone 20 milligrams to me to be taken in a course of 9 days. After watching this, with all these side effect risks, it makes you wonder if it's even worth taking, especially seeing it's only temporarily putting a lipstick on a pig. And I couldn't agree more. Prednisone is truly putting lipstick on a pig. What does that expression even mean? Well, it means that a pig is big, fat, and ugly. And when you put lipstick on it, it doesn't change the fact that it's big, fat, and ugly. It might taste delicious when you cook it. Bacon and ham. Yes, ma'am. But it's still a pig. And putting lipstick on it isn't going to really do anything to change the fact that it's still a pig. It's not a beautiful, whatever it is you want it to be beautiful. It's just a pig. So prednisone is just like that, because what prednisone is doing, it's like putting a Band-Aid on a gushing wound. It doesn't really change what's causing the problem you're taking prednisone for. It saved my life. It truly did. I was bleeding internally. My body was attacking one of my blood cells called platelets, and I was going to bleed to death. Without prednisone, I would be dead. I'm so grateful it exists. But the prednisone didn't cure my condition. It didn't prevent my autoimmune disease. All it did was stop it in its tracks. So whatever was going on behind the scenes in my immune system, whatever strange, bizarre thing that was happening to cause my immune system to attack itself, prednisone didn't stop that background thing, that root cause problem. Prednisone did nothing to that. This autoimmune problem happening sends signals through the body. Prednisone just intercepts the messenger. It's blocking the transmission of those signals. It's not fixing this problem over here. All it's doing is stopping the signals from going throughout the body. And so it's not making the pig into a beautiful princess. All it's doing is putting lipstick right there on the spot where the problem is. And so while prednisone saved my life, it wasn't a permanent solution. And in fact, over time, I personally had to take higher and higher and higher doses to get the same effect, like a druggie, right? Like I had to get higher and higher amounts of, some illicit drug. No, prednisone isn't an illicit drug, but my body needed higher and higher doses to stop the autoimmune attacks. And so the only way the autoimmune condition actually got permanently stopped, well, at least I hope it's permanently, was I had to use chemotherapy to fundamentally change the balance of cells in my body, and do so for a year thereafter. And so prednisone is a miracle drug, but is it worth it? And that's a really tricky question, because for me, life or death, bleeding or not bleeding, it was clear cut at the beginning. Take prednisone, it's worth it. But as I needed higher and higher doses to get less and less of a benefit, the benefit risk calculation changed, right? So the benefit of taking prednisone at the beginning was I got to leave the hospital and go trick-or-treating with my kids on Halloween. The benefit later on wasn't as strong because my autoimmune condition was figuring out how to work around the prednisone. It was still doing its thing. And so the benefit changed over time for me. And especially the higher the doses, the higher the side effects. And the worse my life felt. My quality of life, or QOL is what they call it in scientific studies, was worse and worse as time went on because I wasn't sleeping. I had horrible insomnia. I was gaining weight, big round belly and moon face. I was super cranky around my family with these mood changes from happy to sad all the time. I felt hungry all the time, like craving sugar and craving salt. And I felt out of control with the way prednisone was making my appetite change. And I could go on and on. Check out this cartoon I created of the side effects I personally experienced while taking prednisone. so many side effects. And so the more I suffered these side effects, the less it was worth taking prednisone, right? I mentioned that the only way I was able to stop taking the prednisone and get my autoimmune disease into remission was to take chemotherapy. And after my second round of infusions, I was feeling horrible. Not only did I have prednisone side effects, but I also had side effects from the chemotherapy. And I was just miserable. And I just wanted to sleep. Like, that was my biggest problem, was not being able to sleep. And so when I put my toddler down for a nap, I just really wanted to take a nap alongside my little baby. But as I lay there, I just stared at the ceiling and I couldn't fall asleep. I couldn't stop the prednisone, like racing thoughts, racing heart, just pressure to stay awake. I couldn't stop that. And I had this sudden epiphany. It was as if a voice spoke to me and said, people on prednisone need more than this. And I was like, what? People on prednisone need a supplement designed specifically for them. I thought, no way. Are you kidding me? I'm a pharmacist, and my professors told me that supplements, vitamins, you might as well just take the money that you were going to use to buy the supplement and just flush it down the toilet, because that's how beneficial it is for people. Because it's just going to go right through you. It doesn't do anything. It's all just hocus pocus. And this voice was insistent. You need to make a dietary supplement. And I was like, okay, but I don't believe in them. So, okay, whatever. And then I looked into the research. The one thing I did know going into this, it was like, okay, maybe this is a legitimate thing, and that every pharmacist must know to pass their licensure exams, is that prednisone steals calcium and vitamin D, making prednisone the number one drug that causes osteoporosis. So that was legitimate. Every pharmacist knows that. The doctors who prescribe prednisone the most find it such a horrible problem, they created a guideline about it. The American College of Rheumatology guidelines for the glucocorticoid-induced osteoporosis. And they say that everybody taking prednisone needs to be taking calcium and vitamin D. It came straight from the best evidence they have available from Cochrane libraries and on and on. And so I thought, okay, I'll look into it. And the more I looked into it, the more I realized that prednisone doesn't just steal that calcium and vitamin D. Prednisone is stealing at least 9 nutrients, such as chromium. Chromium I had heard of in my pharmacy school herbalism class as really helpful for diabetes. But I had no idea that prednisone is actually stealing it. And that might explain why, when they decided to name the class of drugs that prednisone's a part of, they called them the glucocorticoids. Gluco meaning glucose, meaning sugar. The kind of sugar your body uses in your blood, your circulatory system, in your cells. Prednisone's named after how it's messing up your metabolism of glucose. That's how it got its name. And so once I saw that it's not just calcium and vitamin D, and it's also chromium, I found all of these other nutrients that prednisone steals, and I was completely stunned. And I realized that there is legitimacy to this need, that it's not like my pharmacy school professors told me. That might be true for other conditions, but for prednisone, it is completely legitimate. You are having side effects like osteoporosis from the calcium and vitamin D, like diabetes from the loss of chromium, and on, because of nutrient depletion, the stealing of nutrients. Like if that plant right there in the back of me, I can't point. If it was yellow and wilting, why would it be that? It would be that because I hadn't been watering it or fertilizing it. And so if I just give it some fertilizer, it'll perk up and be green again, right? That's how it is on prednisone. We're like a wilting yellow plant. We're getting moon face, weight gain, sleep issues, and on because of prednisone causing nutrient depletion. The side effects are from the nutrient depletion. So if you give them back, you feel whole and complete and like yourself again. And so that's exactly why After my experience taking prednisone, I invented Nutrinize Zone. It gives back the nutrients that are depleted in the bedtime bottle and in the morning bottle. You just take 2 of each, 2 in the morning and 2 at bedtime, so that you can feel like yourself again. It has exactly what you need to counteract what prednisone is doing to your body. So you can just click the link below. You can go to nutrinize.com or Amazon and get Nutrinize Zone to help you feel like yourself again and not like you're just putting lipstick on a pig. Nutrinize Zone is designed to take that benefit risk calculation and put it in your favor. That when you have all of these side effects and questionable benefit, that the side effects are outweighing the benefit, but you give back the nutrients with Nutrinize and you're neutralizing that negative. You're bringing it back into balance so that you can feel like yourself again. Just get Nutrinize Zone today so that you can feel back in balance, feel like yourself again, and counteract as many side effects as possible. Signing off as Dr. Megan, your prednisone pharmacist.